I was actually off campus when it happened. I went to go hang out with friends, and as I was leaving their house, they had shoveled but didn't put salt down, and I just slipped. My feet went out from under me, I hit my head really hard, and I was too embarrassed to tell anyone, and then I drove home and thought, oh, everything will be okay, I'll just have a bump on the top of my head. But I ended up going to the doctor shortly after that. I was having a lot of dizziness. I was actually having trouble walking as well. And I just felt really odd, like kind of loopy and having trouble speaking even.
When a patient presents to our office with a diagnosis of a concussion, typically they have had chronic symptoms that have been happening for weeks, months, and sometimes years.
She presented with symptoms of brain fog being a really big one that affected her whole day. She was losing her place a lot. The words were jumping around on the page, which made school really, really challenging for her.
I had a lot of trouble reading. The words would bounce around when I would read. And so it was really hard for me to concentrate or even comprehend what I was reading. That first semester, I was just like not functional at all. Terrible headaches, just trouble in so many different areas.
She was very motivated to get her graduate degree, and now vision was standing in the way of her being able to accomplish the goals she'd originally set for herself.
It was a very emotional time for me. I mean, there were times where I felt really lost and really hopeless and really confused. And then I had a friend say, hey, I think that you had a traumatic brain injury. And I was like, what? And then I started like looking at all the symptoms and I was like, oh my gosh, I have like all of these symptoms except for maybe one or two. I set up an appointment and that's basically how I got here.
When I saw her that day, some of the diagnoses that I gave her first were post-concussion vision syndrome, binocular vision dysfunction, and ocular motor dysfunction, which basically meant she had a hard time now using both eyes together as a team and tracking across the page.
I did not realize how much it affected my everyday life until I started coming to vision therapy and started getting that healing.
One of the things that is especially important for all of us at Well Vision Therapy is that our patients attain the goals that they set out to when they came to us in the first place. That could be return to play, it could be return to the classroom, or it could be return to work.
When I came to vision therapy, I had a few goals. One was to be able to do my normal life regularly. Another was to be able to go into the grocery store and handle it. And another one was to be able to go back to school to be able to teach English again as a second language.
One of the things that we feel is very important at Well Vision Therapy is that we have board-certified vision therapists along with a board-certified doctor overseeing the treatment plan.
Dr. B and Julie were just so patient and helped me to take it slowly. They also really helped just like make me feel comfortable being here, and Julie and I love to laugh together, and I think that made the process a lot better for me.
So what's happening in an office-based model is that we're working with the patients one-on-one with activities that have been designed and prepared ahead of time.
So we began with half-hour sessions in her case because she was so symptomatic, and really started just working on stabilizing her visual system. Once we made it through our diagnostic sessions, we found that she was getting better and becoming more tolerant. So then we moved on to a more intensive office-based vision therapy program, and that lasted for about 40 sessions actually. And we were checking in with her about every 10 visits to see how her symptoms were, and every single progress check she noted improvements and changes happening that were getting her back to the lifestyle that she so badly wanted.
I remember that all of a sudden there were things that I couldn't do before or that would take a really long time for me to recover from, and all of a sudden it was like, it just felt easy.
She just felt like she was herself again, and that was really huge because for so many years following the concussion, she really didn't feel like herself at all.
Life feels amazing. Honestly, it's changed my life. It's so nice to be able to hang out with friends and not get overwhelmed by all the stimuli. Like, I actually feel like I can be present for the first time in like 6 years.
I saw her back after 3 months also and found out that she was going back to school at that point. She also had a job working for Shipt, which was huge for her because I remember at the beginning of therapy, she told me she could not go into a grocery store. It made her super symptomatic. She felt horrible. She was overwhelmed by all the stimulation, and now her actual job that she was doing was to take these huge orders in a grocery store every single day, multiple times a day. So just showed the progress that she made throughout therapy.
That ability to be able to do a job and to do it well feels really amazing. Like, oh my gosh, like I couldn't do this before. Now I can. I feel like I can be myself. I feel like I can be normal. And that's one of the most exciting things, is feeling normal again.